Hi, my name is Glenn Boyd, and this is Peter, and he will be assisting me in my vital signs demo for Health Assessment 1. And so, with the vital signs, we're going to be doing temperature, which I'm going to have to simulate because I do not have a thermometer. I'll also be simulating pain because he is not in pain today. So I'll go over what I would ask him. What we will simulate is blood pressure, um, the radial pulse, and respirations. So we'll go over all of that. So we'll start with temperature. So typically, in an adult, you're just going to do an oral temperature where you place it under their tongue, have them hold it there. Um, Before you do any of these vital signs, you are going to want to do hand hygiene, which I've already done prior to the video. Wash my hands. You want to glove up. If there's something about the patient that you're going to come into that you need to glove up for. Um, and when you'll begin by explaining to the patient, first off, how the procedure is going to go. So you're going to let them know um, how you're going to, you're going to put the thermometer under your tongue and hold it there. Um, and then once it beeps, unless you know that it's gotten the correct temperature, you're going to throw away the slip cover that you've put on there on the probe. And then document the findings. Typically, it's 98.6 to 100.4 for an average adult. If you're doing it in another location, like say the axillary, you're going to wipe that dry, like under here, under the armpit. You're going to wipe it dry. Put it under the skin right here, have them close their arms and hold it there until it beeps. There's also the tympanic membrane one that you can do. And for that one, for for children, it's going to go in the ear, and for children, you're going to pull down and back, and with adults, you're going to pull down or up and back on the pinna, and you're going to place it in there until it beeps. Place the thermometer in the ear, and so that is for temperature. Then for blood pressure, the first thing you do is I'm going to move it up. And typically your patient will be wearing a gown. My patient didn't want to put that gown on today, so we're just doing it in the regular clothes. And so I'm going to start off by getting the blood pressure cuff on him. Typically you have an area to set this up for. You're going to find the brachial artery and kind of line that up here on this there's a little circle with a line through it, and you're going to line that up with the brachial artery. And normally you don't lay your stuff on your patient, but we're making do with what we have here. And so we're going to line that up and then tighten it here. And then, just so I'm in the video, I'm going to get down here closer to the patient. And I'm going to lay the measurement device right here. And you're going to want to place this about an inch or so above the antecubital space right here. And then, so what I'm doing to begin with is I'm going to listen as I pump up the air to inflate the cuff, and stop and go about 30 millimeters per mercury above where the sound stops. All right, so it looked like there that it's about 120 over like 82. What it was looking like. So we're going to document that down. And then we have that going for the blood pressure. And the main thing is that you want to remember is making sure it's on the brachial artery. I'm releasing that pressure and listening to that those Kharkov sounds when they begin and end. So the next I'm going to do is the radial pulse, and I'm going to find that right here. It's on the same side as the thumb. You don't use your thumb to find it, but you're going to go right here. You're going to listen. And normally you have a watch that you're following, but there's a timer right there on the video, so I'm following that. Okay, so I did it for 30 seconds, and then I multiplied that times 2. So my total respirations were 82. Or not respirations, my total, the pulse rate was 82. So I'm going to document that here. It was a pretty strong, had a normal rhythm, didn't feel any abnormalities in it. And then the last thing I'm going to do is check for respirations. And so that's just watching the rise and fall of the chest and see how often that goes. Normally you don't tell your patient you're doing it, you do it while you're doing the pulse, but since we're breaking it down, that's what we're going to do right here. Okay. Yeah, and I should really have a watch on because it's kind of hard to watch from there. And because I did tell him, it kind of made it a little difficult. He did kind of change the way he was breathing. It did look to be about a 12 to 14, but I think it's because he was concentrating on it. So that's why you wait. But yeah, definitely felt like it was a little low. And then last thing I would assess is their pain. I would explain to them this. I'm going to do a pain assessment, ask you certain questions, and you go through the PQRST, which is what provokes it, the quality of the pain, does it radiate, like a location, the severity on a pain scale, and the timing, how long it's been going on, is it go back and forth. And that's my vital signs skills. Thank you.